Introduction to Borderline Personality Disorder, BPD. What is BPD? Borderline Personality Disorder, BPD, is a complex and often misunderstood mental health condition that affects an individual's ability to regulate emotions, maintain stable relationships, and manage their sense of self. While BPD is a serious mental health disorder, it is often mischaracterized by stereotypes and misconceptions. This episode of the Borderline Personality Disorder, BPD, podcast aims to clarify what BPD truly is, examining its core features, how it differs from other disorders, and the impact it has on those who live with it. What is Borderline Personality Disorder, BPD? Borderline personality disorder is a mental health condition characterized by pervasive patterns of instability in mood, interpersonal relationships, self-image, and behavior. These patterns often emerge in adolescence or early adulthood and can cause significant distress and difficulties in daily life. At its core, BPD involves a fundamental issue with emotional regulation. People with BPD may experience intense and rapidly shifting emotions, which can make it difficult for them to navigate personal relationships, manage stress, and function in social or professional environments. While the term borderline might suggest something between two states, the disorder's name is a historical misnomer. BPD was originally thought to be a condition that existed at the border between neurosis and psychosis, but it has since become clear that it is its own distinct disorder with specific diagnostic criteria. Key characteristics of BPD. The symptoms of BPD can vary significantly from person to person, but there are several key features that are common to many individuals living with the disorder. These include 1. Emotional instability. People with BPD often experience intense emotions that can shift rapidly. A minor trigger can lead to a sudden emotional outburst, such as extreme sadness, anger, or anxiety, which can be difficult for others to understand. These mood swings are often short-lived, but they can be overwhelming for both the person experiencing them and those around them. 2. Difficulty with relationships. Individuals with BPD may have turbulent relationships due to their extreme emotional reactions. They may idealize someone one moment and then quickly devalue them the next. This is often referred to as splitting, where the person with BPD sees others as either all good or all bad, without the ability to integrate these opposing views. The fear of abandonment is another common issue. Individuals with BPD may go to great lengths to avoid real or perceived abandonment, whether through clinging behavior or self-destructive actions. This fear can lead to impulsive behavior and a constant sense of instability in their social connections. 3. Distorted self-image. People with BPD often struggle with a poor or unstable sense of self. They may feel unsure about who they are, what they want, or what they believe in. This lack of a stable identity can lead to feelings of emptiness, confusion, and an ongoing search for meaning. 4. Impulsivity and risk-taking behavior. Impulsivity is another hallmark of BPD. This can manifest in reckless behavior, such as substance abuse, promiscuity, excessive spending, or gambling. These behaviors are often a way to cope with emotional pain or to feel some sense of control in an otherwise chaotic emotional state. 5. Self-harm and suicidal behavior. Self-harm is a tragic and common symptom of BPD. Individuals may engage in self-injury as a way to cope with overwhelming emotional pain or to feel a sense of relief. Suicide attempts or threats may also be present, particularly when a person with BPD feels they are facing abandonment or emotional distress. How is BPD diagnosed? To diagnose BPD, a mental health professional uses the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. These criteria include a pattern of instability in interpersonal relationships, self-image, and emotions, as well as marked impulsivity that begins in early adulthood and is present in a variety of contexts. In addition to these behaviors, a person must exhibit at least 5 of the 9 symptoms associated with BPD, which include fear of abandonment, a pattern of unstable relationships, unstable self-image, impulsive behaviors, suicidal threats or self-harm, emotional instability, chronic feelings of emptiness, difficulty controlling anger, paranoia or dissociative symptoms. What causes BPD? The exact cause of borderline personality disorder is not fully understood, but it is believed to be the result of a combination of genetic, environmental, and neurobiological factors. Studies suggest that people with BPD may have a heightened sensitivity to emotional stimuli, making them more likely to experience extreme emotions in response to stressors. Environmental factors, such as childhood trauma, neglect, or abuse, are also commonly associated with the development of BPD. However, not everyone with a history of trauma develops BPD, and not everyone with BPD has experienced abuse. There is likely an interaction between genetic predispositions and life experiences that contribute to the development of this disorder. How is BPD treated? While BPD is a challenging condition, it is treatable. With the right support and treatment, individuals with BPD can lead fulfilling, stable lives. The primary form of therapy for BPD is dialectical behavior therapy, DBT, a type of cognitive behavioral therapy, CBT, designed specifically for people with BPD. DBT focuses on helping individuals regulate their emotions, improve interpersonal relationships, and develop healthier coping mechanisms. Other forms of therapy, such as cognitive behavioral therapy, CBT, mentalization-based treatment, MBT, and schema therapy, can also be effective. Medication may be prescribed to help manage symptoms of anxiety, depression, or mood instability, but it is typically used in conjunction with therapy. The road to recovery. While BPD is a lifelong condition, many individuals with BPD can improve over time with proper treatment and support. It's important for both individuals with BPD and their loved ones to understand that healing is a process that requires patience, compassion, and commitment. Living with BPD can be challenging, but it is important to remember that people with BPD can experience moments of stability, happiness, and fulfillment. With the right tools, support, and understanding, those living with BPD can build healthier relationships, cultivate a sense of self-worth, and live more balanced lives. Conclusion. In this episode, we have introduced borderline personality disorder, BPD, providing a thorough understanding of its symptoms, diagnosis, and potential causes. BPD is a complex disorder, but with treatment, it is manageable. In future episodes, we will dive deeper into the specific aspects of BPD, including coping strategies, treatment options, and how BPD impacts relationships and self-image. Stay tuned as we continue to explore the challenges and opportunities for healing in the world of BPD.